So today I will be demonstrating how to insert and irrigate a NG tube on a patient. And at this time I've already checked the order from the physician and the type of tubing needed. And I've gathered my supplies. I'm in the patient's room. I've already assessed the patient's nares and oral cavities. Oral cavity. There is no deviations or septum deviations. The oral mucosa of the mouth looks really good. It's nice and pink and moist. And patient states that he has no breathing issues. So we can begin the process of inserting the NG tube. Just side note that I'm not for sure if this mannequin is fit for an NG tube, so I'm going to try to do this the best of my ability. So I have come in, I have my tubing, I have a marker to mark things, I have assessed the patient, I have performed hand hygiene, and now I'm going to start the procedure by placing some gloves on. And I've already put the patient in the upright position. I have my NG tube, and we're going to go ahead and measure. It's not technically an NG tube, so don't mind the actual cap on the end here. So what we would do is start at the tip of the nose and go all the way to the ear, and then all the way down to the xiphoid process. And what we're going to do at this point is go ahead with my marker, mark a spot on here to give a rough estimate of how much tubing I need. And I'm going to go ahead and dip this in my petroleum jelly, my lubricant. I'm going to do at least 4 inches of lubricant on the tubing. And we are going to ask the client to tilt their head forward, and I do have some water here for the client to drink. And as I shift this, insert it, and feed it through the nasal cavity, I'm going to start asking the patient to drink, and every time he takes a swallow, I'm going to feed the tubing in as he drinks. If he is experiencing any gag reflex or inability to do that, not to swallow or anything, I'm going to pull back and let the patient rest. And then when he tells me that he is able to move forward again, then we'll go ahead and restart the process. And so I've inserted the tube up to my line, and at this time I'm going to ask the patient to speak. I'm going to inspect the posterior pharynx for presence of the tube, and I'm going to attach a catheter tip syringe to the end of the tube and aspirate gently back on the syringe to obtain some gastric contents. And observing the color, I'm going to test the pH per hospital policy, and then I'm going to re-inject aspirant or air bolus into the tube. But I'm going to, as I do that, I'm going to listen with my stethoscope over the gastric area for swishing sounds. And then after I do that, I'm also going to make sure that I have an order to do a x-ray to make sure that the tube is placed in the right area. And I'm going to measure the amount of exposed tubing from the nose to the end of the tube to compare to a baseline. So if it looks like it has shifted and come out some, or has for some reason gone in deeper, I can measure that and everything and adjust. So at this time, with my tape, I have pulled a piece of tape about 4 inches, and split it in half, So what we are going to do now is anchor this to the patient's nose. And then I have a rubber band that I'm going to attach to this with a safety pin and attach it to the patient's clothes. That way we are less likely to pull this out by accident or anything. And I am going to hook this up to my suctioning kit on the wall for intermittent suction based on the physician's orders and everything. So I have completed this process. It has now been a few hours and everything, and I come back in the room and we are going to irrigate it. So what we're going to do is I've identified the patient, I've washed my hands, and well, upon inserting, I'm going to put the patient back at a comfortable level before I leave the room. Make sure side rails are up, call bell is in place, and everything else. Make sure that I've checked off all my safety. So now we've come back a few hours later, and now we want to irrigate the NG tube. So at this point, I've introduced myself. I have performed hand hygiene, and I'm putting the patient in semi-high Fowler's position, and we'll say that we're about right here. And I had already disconnected or turned off my suctioning, and now we're going to disconnect it. So I will lay a towel over the patient, just so we don't get any stomach contents on the patient and everything. And to check for placement, I have a 30 cc or a 30 ml syringe. I don't have one here, but we're gonna act as I do. So I have a 30 ml syringe, and I'm obtaining gastric secretions by aspiration, gently pulling back. Then I place the stethoscope over the epigastric area, and so as I place over the epigastric area, I am reintroducing the gastric aspirant or air bolus, and I'm auscultating for swishing sounds. And then I'm going to instill 30 mLs of sterile water or normal saline, and instill, so I've instilled 30 mLs of sterile water, and I'll withdraw solution, measure and discard amount of instilled water, saline solution return. So I put in 30, I'm going to pull back out 30 and discard those contents. I am going to reconnect the NG tube back to the suctioning on the wall as ordered. And then I'm going to put the patient back at a comfortable level. I'm going to inspect the color, volume, and characteristics of the NG secretions. And in my documentation, I'm going to use I'm going to notate the type and amount of irrigation solution, the difference in the volume between what was instilled and the volume that was withdrawed. I'm going to chart time and date and make sure that all safety measures have been placed back with my patient. I'm putting them in a comfortable position. Performing hand hygiene as I go out the door and everything, and making sure the call light is in reach. And that concludes this.